All right, good afternoon. Welcome to the Thurston County Board of Health meeting. It's a special meeting for Tuesday, October 11th, 2022. It is 3:35 p.m. My name is Ty Metzer, Chair of the Board, and we have our new fully constituted here Board of Health. To my left is Board Member Gary Edwards. To my right is Board Member Carolina Mejia. Participating through our hybrid platform, we have Board Member Maria Williams, Board Member Lynn Nelson, and Board Member Dr. Beth Harvey. Board Member Vasquez will be joining us just here in a few minutes. This is the first meeting of the expanded Board of Health, so we have a lot of logistical items to get through today and hopefully set a good process forward for future Board of Health meetings. First thing we have to do is look at the agenda. Are you my vice chair, Board Member? Yeah. No, Board Member Edwards, my vice chair at this point. So, is there a motion regarding the agenda for today?
I would move to approve today's agenda of October 11th, 2022.
Is there a second?
Second. I was going to see if any of them would.
Board Member Mejia has seconded that, and so we have a motion and a second on approval of the agenda. Any
Robin's in here.
Robin's joining us. Any discussion?
No discussion, sir.
Hearing none, call for the vote. We do roll call votes, so you'll get called out specifically to give an aye or a nay. It just makes things cleaner for the record.
Just voting to approve the minutes real quick. Board Member Vasquez?
Aye.
Board Member Williams?
Aye.
Board Member Nelson?
Aye.
Board Member Harvey?
Aye.
Board Member Mejia?
Aye.
Board Member Edwards?
Aye.
Board Member Mentzer?
Okay, we have meeting minutes from September 6th. This was our last meeting, board meeting minutes. I guess it was the four of us at that meeting. So is there a motion regarding September 6th minutes?
Yes, sir. I would move to approve our meeting minutes from September 6th, 2022.
Second.
Moved and seconded to approve minutes from September 6th, 2022. Any discussion?
No, sir.
Hearing none, you can call for the vote.
I just want to clarify when I call for this one that I'm only calling for you guys that attended last time, correct? Okay, perfect. So then Board Member Vasquez?
Aye.
Board Member Mejia?
Aye.
Board Member Edwards?
Aye.
Board Member Mentzer?
Aye. Motion carries. So those meeting minutes are approved. And this is a new experience for all of us, so we may kind of tweak some of the procedures. We may not stick with roll call voting. We will kind of work that through as a group as we go. That's how we do it on the Board of County Commissioners, but there's only 3 of us, so less cumbersome. First item on today's agenda, substantive item, is a Board of Health orientation. We have Kurt Harden, our Interim Director of Public Health and Social Services, also Emergency Services Director is listed, but the idea here would be to with our new members to kind of give an overview of some of the ins and outs of public health versus healthcare versus the legal framework versus roles and responsibilities of the Board of Health. I'm going to turn it to you, Kurt.
Okay, thank you, Commissioner. Okay, so first of all, let me, if you can't hear me on the Zoom call, please let us know, raise your hand, but hopefully everybody can hear me. I would like to say again, Kurt Harden.
Can I stop you, Kurt?
Yeah.
Is there any way that I would know if someone raised their hand to call on them? Is there a way to put them like on a strip on the side? Yeah, can you make them like a yeah, there we go. That would be good, I think, just so I could see. Sometimes you can do the split screen, where you don't actually, it's not actually overlaid the slide. I don't know if that's.
You want me to explain it?
At least something to think about. We don't have to worry about it now, but that's the perfect thing because you've got your slide and then I can see the people and it's not too many people. So anyway, but go ahead, Kurt.
Okay. For the new Board of Health members, I am the interim director of public health for the Public Health and Social Services Department. There is a current recruitment process going on for the permanent public health social services director. My full-time day job typically is director of emergency services. So that's why there's some a little bit confusion on the agenda. Also up here with me at the table is our public health officer, Dr. Abdimalik. So as we go through, if you have hard questions, she gets to answer those, and I will give you the outline and explain some of the easy stuff. My apologies up front to board member Menser and Vasquez. This may look familiar to you because I stole a lot of it from Walsalfo's conference. So we're going to go through as Board of Health member Menser talked about. Next slide, outline. Okay, we're going to try to break it down into what is public health and then what is healthcare, and walk through some of the responsibilities. We're going to talk about the 10 essential services, and we're going to talk about public health 3.0, but we'll talk a little bit also about 1.0 and 2.0. So it gives you a little bit of background as to where we came from. Next slide. This, if I could say, I would try to keep this with you because key public health acronyms, I will tell you that I still refer to this sheet quite often because public health is anything, like every discipline out there has a lot of acronyms. So please, if this will help you as you walk through the process. Next slide. So public health, the traditional definition, it's a science of protecting and improving the health of people in their communities. But it's an essential service guaranteed to all residents under the RCW, and it's RCW 4370.514 under public health definitions. But that gives you the traditional definition, but a more modern interpretation on the next slide. Public health promotes and protects the health of everyone, communities where they live, learn, work, worship, and play. And it really talks to everyone in the community should have the opportunity to achieve their optimal health. And you'll probably, if you've already looked at the slide, you'll see a definition later on in the slide deck between equity and equality. And we'll talk about that in a little while as we get through the presentation. I should say, if you have questions, please feel free to raise your hand, ask here in the boardroom, because I've learned that if you wait until the end, if you're like me, I may not remember my question when I get to the end. So I typically like to ask the question as I go through.
Yeah, I don't care if I see a little yellow or if somebody just wants to wave their hand, however's comfortable, I'll keep an eye up and feel free to raise your hand.
Okay, next slide. So I think everybody understands that public health is not healthcare. Public health works to address the larger impacts across the community, not the outcomes themselves. And there's some examples down here, such as public health treating poor drinking water, because public health care focuses on treating someone with, and I hope I'm pronouncing this correctly, giardia, and Dr. Abdimalik giving me the look. But so that's where healthcare focuses on that. Public health treats diseases, whereas the healthcare focuses on treating individuals with diseases such as measles. So, and public health is efforts based on population-based efforts to support individuals and to support population-based efforts, whereas individual healthcare is different, and it's part of the healthcare system. And you can see the examples here of behavioral health services where it's not public health, but when you're talking about community prescription take-back programs, that is public health, and you can read through the other two examples here. So it's just trying to define and show examples of what public health is versus healthcare. Next slide. And you can see here, overall in the 20th century, the statistic is 30 years. The average lifespan worldwide increased by 30 years in the 20th century due to public health, 25 years of those because of effective public health. And you can see the examples up here from clean water, safe and clean water, occupational health, immunizations. I mean, there's a whole host of areas in here where public health was made an impact in the extending the average life expectancy for people. Next slide. So here we have the 10 essential public health services, and we're going to go a little bit more into detail in all of these, but they're broken into three different categories: policy development, assessment, and assurance. And you can see the sources are quite often on the slides down at the bottom. Next slide. Okay. What are they? And they provide the roadmap for fulfilling the missions of public health. You can talk through this. It provides the framework. And these were developed in 1994, but also updated recently in 2020. So as we focus on public health itself. First one that we're going to look at, assessment. Talks about taking leveraging our data sources and systems. And you'll find that a lot of areas in public health are data driven. We use data to drive decisions, make policies, and do actions. And understanding the State Department of Health and what they're doing and deploying strategies to achieve equity. You have outbreaks, hazards, and emergency response. So when you're doing the assessment, that's what we focus in on under assessment. And down at the community local health jurisdictional level, you have community health assessments, youth suicide prevention programs, STI investigations, local COVID-19 data dashboards. I think we're all familiar with a lot of COVID information over the last 2 years. And then responding to foodborne outbreaks in restaurants as examples. Okay, thank you. And then the policy development area, building community trust with culturally appropriate communication. And it's important and critical that we build that trust out there with the community in the different areas and demographics within the community. And then providing effective, efficient, transparent risk communication. As we look at this and looking at applying federal and state guidelines, we know that we have to enforce state and local laws, the RCWs, the WACs, the ordinances, but we'll also talk a little bit about grants and grant guidance from both the federal government and the state government. But in the local health jurisdiction, you have CHIP, or Community Health Improvement Process and Plans. You have media warnings on blue-green algae blooms and recreational lakes. I would say that you see a lot of that over the summertime with our lakes around Thurston County. On-site sewage system permitting and inspections. You may not see as much of that out in the media, but we see a lot more of that here in the public health department. Vital records, which is critical, and then child death review teams, which is going to be an area that we talk a little bit more about under foundational public health. And then the third component, assurance, where we connect and bridge access to health, social and behavioral care, and dismantle barriers to care. And we'll talk more about that a little bit as we go through this, but we want to cultivate and foster public health workers and leaders as we apply the research and science to public health operations and programs. Like I said earlier, data-driven, and we operate with transparency and inclusivity. Examples of this, gap-filling direct services, family planning, needle exchange, partnerships with health care organizations, long-term care, behavioral health, supporting training and development opportunities for staff, and then the support piece of it, fiscal accounting, reporting of federal, state, and local funding. So just examples of that area. And now we're going to talk a little bit about Public Health 3.0. We'll talk a little bit about 1.0 and 2.0 as we get there as well. So on this slide, you can see we started with Public Health 1.0, and that was in the late 1800s. And you can read there about how there was uneven access to care and public health. And then we went into Public Health 2.0 right around the 1980s, where we systemic development of public health government agency capacity. We focused was limited to traditional public health agency and programs. And then we did Public Health 3.0, as you can see right here. And it refers to a new era, came around at the end of the 2000s as we came out of the Great Recession, and enhanced and broadening public health practice. And it goes beyond traditional public health department functions. What we want to look at is determining to improve the social determinants of health and achieving health equity. And we do that through collaboration. And we'll talk a little bit about these areas as well, including the chief health strategist in upcoming slides. Next slide. So here's your buckets. And you have bucket 1, traditional clinical prevention, bucket 2, innovative clinical prevention, and bucket 3, the total population or community-wide prevention. And you can see how all that ties together from bucket 1, healthcare, to bucket 3, public health, and the overlapping area where you're providing services outside the clinical setting. We're going to go a little bit more into these 4 areas here. The chief health strategist, we'll start with that one. Next slide. So chief health strategists, local public health departments serve as a chief health strategist for their communities. And there's the link there to where this came from. But when you look at the bottom in the areas, we're talking about combating the causes of illness, injury, death, all the way across, working collaboratively with local, tribal, state, federal partners. Again, here's the data, using data to inform decisions and educate communities. Like I said earlier, data-driven. Linking it to healthcare by enhancing access to healthcare for everyone in the community. And then engaging new partners to address the social determinants of health. So you look at public health departments as the chief health strategist within the community. And then as we go into the social determinants of health, conditions and environments in which people are born, live, learn, work, play, worship. We talked about that earlier. These are the areas of the social determinants. Education, healthcare, the environments within the neighborhoods, social and community context, and economic stability. Those are the factors that determine our social determinants for health. And I like this slide because it talks about and shows, depicts the difference between equality and equity. In the top part, under equality, everybody gets the same bike, but they may not be able to utilize that bike. Whereas in the bottom part, under equity, everybody gets the bike that meets their needs, as you can tell on the slide and the four individuals that are depicted there. So I like this because I think it really shows health equity and how our approach to health equity is lined up. Next slide. I talked about collaboration and partnerships, and this shows under the items at the bottom, public, private, economic, educational, spiritual, and multi-sector. In order for public health to be effective, we have to do collaboration. We have to have stakeholders and partnerships established across the community for an effective public health approach. Next slide. So Public Health 3.0, the call to action. The chief strategist for the communities, that's local public health, embraces that role. And then you have structured cross-sector partnerships. Public health departments engage the community stakeholders in that area. And then you have actionable data. And I will tell you that the actionable data, we have data sources and we have folks who are specialized in pulling that data together, but getting that data that's relevant, and also the metrics that are, what's the word I'm looking for? That have been vetted and through scientific studies, et cetera. Because we want to make sure we're using qualified data. And then the funding for public health, we'll talk a little bit more about that, especially when we go over the public health and social services overview, which is not today, which is going to be in a future agenda setting, because there's a lot on the agenda to be determined today. But also we'll talk a lot about the funding for public health and how that's been modified and enhanced over the last several years. And then Public Health Accreditation Board, the last one there, number 5, for accrediting the public health under the 3.0 principles. Next. So local health jurisdictions. So here's the RCWs that drive, and this is by no means all the RCWs, these are the main ones. As you look through and determine what determines and drives, 70.05 is local health departments, boards, and health officers. But public health also goes down into 70.08, which is city county departments. You have health districts with their own area, public health funds, control and treatment of sexually transmitted diseases.
But we got a question.
Yes, ma'am.
Since I will certainly forget it if I let you go too
Sure,
much
please.
further on, do we currently do accreditation of local health organizations?
The answer is we don't do the accreditation. We start the accreditation process for public health and social services, and then COVID came along. And so that kind of put the brakes on it. We did start down that path. And one of the things we need to do is restart the accreditation process.
Is there anything that we need to do as a group to restart that process, or just begin doing the actions again?
We need to start doing an assessment of where we are and then go through and see if there's anything that's changed over the last 2 years in the accreditation process, but we just need to take a look at it, a hard look at it.
Okay, thanks.
But we did start it. We just, COVID, and I know a lot of, it's probably gonna be a tired phrase, but COVID is gonna be the reason for a lot of things in life. But we need to go ahead and start fresh and start moving in that direction. And correct me if I'm wrong, Dr. A, but I think that's, yeah. I don't have all the historical knowledge. I only have mostly from January, but I have read a lot and seen a lot since January about what took place.
Got 8 months more than I do.
Okay. But anyway, the rest of the RCWs here, influenza preparedness, I think we've got a lot of information on influenza preparedness and pandemic preparedness right now. I won't say influenza, but we'll say pandemic. The tuberculosis, vital statistics, and on-site sewage disposal systems. And again, all these are where our lines of authority come from. Next slide.
Kirk, do you have a slide that, I don't want to get ahead of you, but do you have a slide that like shows that, I think it might be 7005, but the kind of statute that says what the Board of Health's authority is?
I will go down here to talk a little bit about the Board of Health Authority because there is a slide down here and talks a little bit about that in 7005 here later on in the local health jurisdictional area.
Spoiler is that it's very broad. I mean, it's basically anything connected to improving the public health and with, you know, Public Health 3.0 and the social determinants of health. The Board of Health has a lot of latitude to work in a particular area based on the statutory authority. Just
Right, exactly. And we'll come to that here in just a little bit, in just a moment. But so that's a preview, like you said, spoiler alert.
yeah.
But if you look on this, as you look at the lines of authority, it starts with this Constitution, Washington State Constitution, State Board of Health, but the State Board of Health then goes down to the local Board of Health, and then from the local Board of Health, you come down to the administration and health officer authorities. That's where all those determinations are. Local Board of Health, and that, by the way, was the health officer administrator side. The local Board of Health, you start with the Constitution as well, goes down to the Board of County Commissioners, and then the local Board of Health derives their authority from the Board of County Commissioners. So one of the things that we want to point out is that Board of Health, local Board of Health, does policy, but the Board of County Commissioners does administrative as far as budgeting and administrative policies. And so sometimes those cross over a little bit, but for the most part, it's easy to think of as, if you're asking for money, we got to go to the Board of County Commissioners. If you're looking for a health policy, that's the Board of Health. And that's how mostly I understand it, and that's the explanation. I think that is the best way to look at it. Some recent changes for the Board of Health, local boards of health. Pre-2019, the Board of County Commissioners were the local Board of Health. The county legislative authority served as the local Board of Health. And starting in 2019, House Bill 1152 was passed by the legislature, which required expansion of the local Board of Health. That was the process that was utilized by the Board of Health to recommend to the Board of County Commissioners to appoint additional members to the Board of Health. And it seems for those new members, Board of Health members, the Board of Health interviews and recommends members of the Board of Health to the Board of County Commissioners, but it's actually the Board of County Commissioners who appoints the local Board of Health members.
And that's going into the future?
What's that?
Is that true going into the future?
That's the way it's written, yeah, going into the future. So the Board of Health will still interview new members coming on, applying for, say, a vacancy. However, it's a recommendation to the Board of County Commissioners to make the actual appointment.
So it's like SWAT, I guess.
Okay.
So it doesn't tell me what happens if the Board of Health and the Board of County Commissioners disagree. So that's for the lawyers to figure out. Next slide. These are other local Board of Healths around the state. They're for Thurston County, we're a county health and human services. That's how we're set up. We have public health and social services inside of the public health department. You can see by the color coding there, there's different public health jurisdictions around the state.
Can I ask a question
Yeah.
on some of these?
Sure, absolutely.
For the city-county district, I thought that one was interesting, just because how we're set up, you know, it's generalized over the whole county, including cities. So what is that city-county district like? How is that?
So it's interesting because Seattle, King, and then Tacoma Pierce are that city county. And I don't know the nuances of the differences other than, and maybe how their governing is set up as far as who has seats on the local board of health. I don't know. I'll have to go back and get you some information on that. I don't know off the top of my head.
I just thought it was interesting.
Well, and it's interesting that Snohomish, which is set up as a single county district, is a public health district is going back to a county public health department. So they're starting, I think, January 1st, they're gonna go back to the same model that we have here in Thurston. So I thought that was interesting. So I don't know why or what drove that. Next slide. So these are the 2019 funding sources and expenditures for public health. And this is statewide. This is local health jurisdictional expenditure report. You can see the breakdown there between licensing, permits and fees, local government, federal revenue. A lot, I would say, for Thurston County Public Health and Social Services, 85% of our funding is external, is federal or state grants. And Robin, does that sound about right?
So you're saying this gray piece in Thurston County is less than 36%?
Correct.
Okay.
Drivers of local health jurisdictions. Our laws, the state RCW is top and drives what we're doing. Then the WAC is the implementation of the RCW, and it's the rules that the RCW has implemented. Federal block grant focus and needs. So we have, like I said earlier, a lot of our funding is state and federal funds. So each federal, typically, and I'm going to use the word typically because I know as soon as I say always, there's an exception, but typically federal grants have a notice of federal opportunity and there's grant guidance inside of that you have to follow if you want the federal funds. And so when we say federal block grant focus and needs, that has its own rules inside the federal grant, as an example, that we have to follow, even if state law or county ordinance allows us to be more liberal with the funding. We have to follow the grant guidance. Then local needs and priorities, and then categorical funding by a competitive grant process. And so there's always grants out there that you can compete for. In fact, we're competing for, an example is, we're competing for under environmental health, environmental services, a Department of Ecology grant that we're applying for this week, I believe is the deadline, isn't it? So anyway, local board of health primary roles. Now here's where we're going to start talking about the roles and responsibilities. Policy and administration, enforcing local board of health, enforcing state and local laws and rules, controlling and preventing disease, preventing and controlling nuances, appoint local health officer and establish appropriate fees for health-related areas. Now, having said that, as board member Menzer mentioned, almost everything is tied somehow to public health. And I'm going to use our veterans food security issue that just came up and has been developing in the last month or two. Food insecurity amongst our veteran population is an issue. And we have a pilot program that we're proposing in front of the Board of County Commissioners to seek for funding to see if we can help address food insecurity for our veteran members population out here in Thurston County. That's an example, food insecurity is an example of public health. And that's how public health ties in there. So almost everything you can look at can be tied back to public health. Next slide. Oh, there we go. Local Board of Health primary role is vision and direction setting. Like I said earlier, policy. So when the Board of Health looks at a policy and determines that they want to set a policy for community wellness, that's one role. But if there's resources that's needed for that policy, then that flips over to the Board of County Commissioners to fund the policy that is being recommended or being put in place by the local Board of Health. And then strategic planning on long-term vision and agency direction. And then again, community engagement. So we're talking about educating the public. We've seen a lot of public education going on during the pandemic, but it's not, as we roll out of the pandemic and go into non-COVID traditional public health roles, there is public education on vaccination, non-COVID vaccination. There's public education on maternal child health. There's public education on a whole host of areas that, as our PIO is here, we're starting to re-energize because for the last 2 years, or 2.5 years, our focus has been almost solely on COVID. And so we're coming back into that area, we're educating the public. Promoting health and safety, tobacco cessation, vaping. Well, there's a lot of areas out there that we need to promote health and safety. And then health planning, along with gathering from the community input and feedback, because we want them to be partners in what we're doing inside of public health. And then, obviously, public health and social services serves as a point of contact for the community.
You've got, just to call attention to my point, you've got the specific language of 7005 at the
Right.
bottom of this slide and the 2 slides back. And that's what I wanted the new Board of Health members to see, because if you're wondering, like I was when I joined the Board of Health, what are we allowed to do? A lot. I mean, if we want to, it's up to us, but you know, that
Almost every,
supervision of all matters pertaining to preservation of life and health of the people in the jurisdiction. You can think pretty big in terms of what your interests are and how it might connect to the work of this group.
absolutely. Next slide. So working with local health officials, director and administrator, you can see on the left, budget, finance, staffing oversight, program service delivery, etc. But on the health officer side, what Dr. Abdulmalik focuses in on health hazards, enforcement and orders, threats and emergencies. And that gives you the RCWs and WACs that gives the authority to the health officer and also gives the guidance to the health officer by looking at those RCWs and WACs. And then the public health officer has this criteria: shall control and prevent the spread of any dangerous or contagious or infectious disease that may occur in their jurisdiction. That's also a wide-ranging charter. So,
We saw that in action
but yes,
in the last couple of years.
absolutely.
I have a question on this
Absolutely.
that might be of interest to the new board members. So when you talk about, and this is out of the this quote in red, that's a statutory quote?
I believe so, yes.
And I think it, you know, the administrative officer, when we went to that training, we heard from jurisdictions where they hired somebody else. Like they hired it, that was an employee. Whereas in Thurston County, we've had the director, our public health director, serving as the administrator.
Right.
But, and I guess I'm bringing this up because we have to, there is a process by which, I'm looking at the county manager, I think we've talked about this, there is like the Board of Health formally makes that designation.
Yeah, by appointment.
And, you know, so I just wanted folks to understand that they're, you know, in the future, maybe we would need to think about that. Traditionally, it's been our public health director, but we will have that step that we take to make that designation.
And it might be appropriate to change the designation because as the expanded Board of Health, your scope has expanded and there may be more requirements and duties for the administrator position than what was previously done.
Exactly. Yeah.
Next slide. Here's a list of resources. Clicking on the link, and that should take you to the location on the web. And it's interesting to note that there's a lot of information out there on public health. And then if you have the time, it's great to be able to look at that. And I'm going to be the one to tell you that if you look at NACCHO, that is not in your list of acronyms. And I apologize, but National Association of County and City Health Officials is NACCHO. So unfortunately, we missed one. And I'll tell you, we probably missed more than one. So, but that's NACCHO, and they're out there as well, and a great resource too.
Before I open this up for questions around, I was hoping Dr. Abdulmalik, if you could maybe introduce yourself. I didn't have you do that, and maybe just kind of comment on how your job fits into this whole kind of scheme, that Kurt just laid out, or what your experience has been. I don't know, just said any comments you have that might be relevant to that presentation.
Sure. Good afternoon. Good afternoon, Board of Health. I'm Dr. Debiana Abdul-Malik. I have been the Thurston County Health Officer since July 1st, 2020. And it has honestly been an incredible privilege. Really, the way I see my role, I think it was captured pretty well on the slide. A major part of my role is controlling the spread of communicable diseases. I also have some enforcement responsibilities, thinking, along the lines of, some of the work on septic systems, some of the work that's been done in terms of like the smoking ordinance. The health officer authority is the authority that kind of underwrites some of those activities. I also serve as the physician of record for clinical activities that the public health department undertakes. So when we do a vaccination event, that gets performed, under my standing orders, as well as kind of supporting the clinical parts of our activities as well. So a lot of my, the other part of my job is kind of is the education piece. That's probably one of my favorite parts of my job, but also it's listed a little bit further down in the WAC that lays out the health officer's responsibilities. So I do have so the role of the health officer is fairly complex, and the goal really is to identify risks to the health of Thurston County residents, take such actions as are needed, to mitigate those risks, and also really educate and work with the public so that the public understands what the risks are and how to take care of themselves. And then there's several other kind of more legal pieces that I also participate in. But I'm happy to answer any questions anyone may have.
Any questions for Kurt or Dr. A about these kind of topics? Come up there. No? County manager.
Since the Board of Health designates the administrator of the Board of Health, the Board of Health is responsible for the hiring of the health officer.
Mm-hmm.
And there is not county staff, the county manager does not have a role on hiring of the health officers, purely the responsibility of the Board of Health.
Commissioner, or Board Member Edwards.
I guess my question would be maybe to Kurt. Who could be the contact person for new members or us old members that, so we wouldn't bug you necessarily or Dr. A, but we have a concern about a role about this or that, whatever it might be. Who would you suggest be a contact person for mainly new board members, because I think we've all been through it, but so they can find out or get their questions answered about something that they just maybe comes to mind to make them a better board member and a more knowledgeable.
And that's a great question, because I was gonna already offer up, it has to be myself, because then I can farm it out for policy issues, and I can go to Wasalfo to get the answer, or I can go to other location areas to get the answer. But I think it should come to me, because if it's gonna be a policy issue regarding local board of health actions or activities or whatever, I'd be happy to take that and then also get to the appropriate answer. Or I'll, Dr. Abdul-Malik, if it's a public health officer question, I'll send it to Dr. Abdul-Malik. And you're right, I'm not looking for work, but but I also want everyone to know that please feel free to reach out to me, because I can farm it out, coordinate it out to the various locations in the public health department to get answers, or go to Wasalfo or go to the state to get answers.
And if it's a purely procedural, like our clerk,
Right.
Jeannie Caldwell, who I think you guys probably all have communicated with, you know, if it's like, what time is that meeting, or, you know, what, you know, those type of questions that are really,
Yeah, Jamie's probably the better person, because I'm just gonna go to Jamie and go, Jamie, what time is the meeting? So.
okay. Well, not hearing any questions then. So this agenda is in a slightly, so, you know, the topic category is proclamations and presentations. This was a presentation, obviously. A lot of times we have a proclamation and then we do the opportunity for the public to address the Board of Health. We wouldn't typically have such a long substantive presentation and put the public comment after. So we'll tweak the agendas. But for today's purposes, now is the time for the community to address the Board of Health, if there was any public. And I don't think we have anyone here in the boardroom that's not staff, and we don't have anyone on Zoom, so I think we can move along. Sometimes we've had sometimes we don't have any, and sometimes we've had a lot, so it just varies. We usually offer 4 minutes per citizen if they would like to speak. So the next 3 items under, doesn't have a title there, but the next 3 items are really more procedural to try to get this new Board of Health kind of moving forward with some orderly procedures. The first one is Board of Health Officer designation. We cannot take action on this today, but we, because of a quirk in how we wrote up the special meeting agenda, so apologies there, but we would like to have a discussion, nominations, maybe get the issue sorted through, and then we can formally do that at the next meeting. We'll take the formal legislative action. I've been serving as default chair of the Board of Health. Board Member Edwards is our vice chair based on the prior Board of Health. But we now have, I think it's 1-year terms based on when we take that action. So if we do it at the November meeting, it would run from November of this year to November of next year and could be shifted at that juncture. And all we need is a chair and a vice chair. Those are the 2 officer designations. So I guess I would open the floor for.
Before you do that, I was gonna ask, did you want to explain for the new Board of Health members, the
Yes.
difference between a special meeting and the regularly scheduled meeting where you can adjust the agenda with board action?
Yeah, it's just a quirk in, if you have a resolution or a code that lays out regular meetings, then you're subject to kind of one set of notice procedures. And if you're gonna set a meeting at a different time, making sure I got this right, and looking at town manager, then you have to do a special meeting. Well, we don't have an ordinance yet that's lays out the way this board's gonna operate, so we've been operating on special meetings. They're a little more limited. You have to have notice in certain ways at certain times, and you cannot adjust the agenda. So the fact that it was written a particular way, we can't make that adjustment today the way we will be able to once we get kind of on a regular meeting track. So that's just that. I guess just to say the chair and vice chair, the chair, you know, obviously just kind of conducts the meetings. I assume the chair will be involved in setting agendas, although that's a topic here we're going to address. I guess it wouldn't have to be that way, but I'm suspecting that whoever is chair will be involved in agenda setting in some way. And vice chair serves essentially, if the chair is not available, I don't think at this juncture we really have any special duties beyond that basic structure. So just in case you're interested, is there a nomination, I guess?
Yeah,
Commissioner
I'll
Edwards?
make a nomination.
Go ahead.
I would nominate board member Ty Menzer to be the chair.
Any other nominations for chair? Not hearing any? I guess can we then, could do that by acclamation or any objection
Well,
to that?
I don't think we can do it at this meeting, but
That's right.
we're gonna be darn close to
Well,
doing
we've
it.
got one nomination for
Yeah.
the meeting to.
Because we don't have a nominations committee.
As
So-
Robert's rules require, we call for nominations 3 times.
Call for nominations 3 times. Okay, any further, we haven't had to do this before. Any further nominations? Second time? Third call for nominations for chair of Board of Health. Okay, hearing none. Then my name, I guess, will go forward to the next meeting. Nominations for vice chair.
Yeah, I got an idea. Oh,
You want to do it?
well, I haven't talked about it, but I don't know, I'd like to see one of our new members, and I'd call maybe on Robin if she was interested, because she's familiar with the governmental process where maybe some of our new folks are not. Nothing against any of our new folks. It's just that it's gonna take a little while to figure it all out. So, that's my.
Are we able to,
Yeah.
are we able to nominate ourselves?
Yes.
Yes.
I nominate myself for vice chair.
Okay. Second nomination, and any other nominations for vice chair? Second call, third time I'm gonna ask, nominations for vice chair. Okay, so 2 nominations for vice chair. We cannot vote today.
You cannot vote, so that will be next meeting where you take an action. Where you can probably have a discussion between the 2 nominations and see where the board members are related to the 2 nominations. So at least at the next meeting, you will have an indication what will be the chair, vice chair. I will encourage the Board of Health members to have a conversation on those 2 nominations. And,
Today. Okay. Anyone would like to speak in favor, or, actually, why don't I give each of the nominees a chance to, Robin, start with you, Board Member Vasquez.
Well, I didn't expect to be nominated.
Yeah, we didn't talk,
So
this isn't.
I don't have a speech prepared. And actually, I'm excited that Maria wants to step up also, because I think Ty has a lot of experience with the governmental processes already, having served in this role for a while, but Maria brings public health experience that I don't have. So this isn't really normal that someone who's nominated speaks for the other nominee, but I would yield to Maria's expertise in this space.
And I'd just like to make a comment if I could.
Yeah, go ahead, Board Member.
The whole idea that I had was to get somebody that had understanding of Robert's rules, you know, the stuff that we have to deal with. And, no, I'm good. I was just trying to make a, easy adjustment in this new process, because we've only been doing this since what, July 1st? I mean, that's when because of the state law requiring this, and that's when we got things going,
There's a
so,
sort of comfort in all of us being new.
yeah. So
I had the same inclination to try to include one of our new members. I was gonna look to Board Member Vasquez, because I thought maybe I could twist her arm, but I didn't. Since I wasn't sure if one of our new community members would want to volunteer, but since Board Member Williams has volunteered, I'm very comfortable with that as well. So, any other discussion? I guess we'll take a vote next month. But is there anybody else that would like to weigh in? Any perspective?
And I might add, we have never been able to talk amongst ourselves. Any 2 of us became a quorum. So, any of the nominees, I'm sure, feel free to lobby your fellow board members and, as to why you might want to do what you want to do. I want it all to work. I want it to work as smoothly as it possibly can.
that's a newly found freedom.
Yes.
I didn't say that.
That's worth talking about for the benefit of the new board members as well, is the restrictions on what constitutes a public meeting and what quorum looks like for the new board, because that has been a barrier in the past and it necessarily isn't now.
Right, so the board is 8 members, and so right now a quorum is 4 members, if I'm remembering correctly.
Of the members present.
Of the members present, so it's, since there's 7 members present as an example, there of 7 seats filled, 4 members create a quorum. So 3 members can talk amongst themselves and not be in violation of the OPMA. However, if 4 members got together and they were talking about anything other than the Mariners loss, then they wouldn't be able to do that, but they could commiserate about the Mariners loss right now. So anyway.
No board of health
Yeah, you lost,
business with 4 people or more.
Yeah, so anyway, so you gotta, keep in mind that you can talk amongst yourselves as long as it's 3 or less over agenda items, yes.
And I think I want to carry this one step farther, how serious the violation is if somebody wants to pick on you about violating the Open Public Meetings Act. And as far as I know, if you violate the Open Public Meetings Act, you're on your own as far as any defense. Is that right?
Yeah,
I-
personally liable.
Yeah, and so is it, I wanna make sure I don't overstate it and scare folks away, but
So let me investigate a little bit more because the Board of County Commissioners are protected by insurance, but you're liable for up to $500 for every offense. But I
personally,
personally.
I thought we were even more liable than that, to be honest
So
with
let
you.
me investigate how the new Board of Health makeup will be in terms of coverage. That would be a good follow-up from my end.
Okay, well, we'll report back on that, but it's, point's made. It's a serious situation that we have to always be mindful of. Honestly, it's way easier in a context like this, you know, unless we were all getting together for dinner or something. I mean, it's not gonna casually come up that four of you are probably, or four of us, I should say, are together speaking about it, but it can happen. It's a lot more difficult when there's three of us, because that means two's a quorum, and we
Yeah.
can't even speak, you know, and that's a lot more
Don't even
difficult
look
to
at each other.
navigate.
Oh, we tried that, yeah, it's really touchy.
Yeah, County Manager.
I personally, if I may, I would love to hear from Board Member Williams as to why she would like to serve as a board.
Sure,
Sure.
Board Member Williams, are you willing to share your perspective on why you'd like to serve as Vice Chair?
Well, I'm one for taking on a challenge, and so I feel like there might be some, challenges along the way, but I'm willing to support the community in the best way possible, as has always been my passion to do so, and I feel like I'm in the right position to do so. That's
Okay, thank you.
it for now. I was not prepared for a speech.
Yeah,
I was just
no.
kind of being bold and seeing where that takes me, and yeah.
We like that, excellent. All right, so we can leave it there then, and we'll formalize these appointments and vote on the Vice Chair next month, next meeting. The next item is a simple item, but potentially complex at the same time, which is a determination for regular date and time. So we're gonna be bringing forward an ordinance. Is it called an ordinance, resolution? A resolution to kind of set the new regular meetings for this Board of Health. The Board of Health has been meeting on Tuesday afternoons following at 3:30 essentially, just like we are today, on the second Tuesday. Maybe, and maybe that's a good time, maybe it's not. It's initially the fact that it follows Board of County Commissioner meetings, which start at 2, and sometimes are done at 3:30 and sometimes aren't done at 3:30, led me to think that at a minimum, it should, we don't want you guys to be we don't want the Board of Health members that are not on the Board of County Commissioners to be sitting around waiting for an especially long Board of County Commissioners meeting. That's not respectful of your time and commitment to this board. So we knew that at a minimum, we should push the time back. And maybe we need to change the day or make it is it better to have a daytime thing? Is it better to have, I looked at boards of health from around Western Washington and found a whole range. Some meet at night, some meet during the day, some meet multiple times a month, a lot of them meet once a month. Everything and anything is done depending on where you look. So there is no just way it's done. It's really up to us. And so I don't know if this was a sheet that everybody got or just, this is a sheet that showed that Commissioner Mejia or myself, Board Member Edwards and Mejia, since we've got schedules that everybody had access to, I think Jamie kind of pulled through and saw when we were available what options might be. But we need to kind of have a generalized discussion about what would work best for all of the members. And it may not be perfect for everybody, it may be impossible with 7 of us, but does somebody want to just start up and say, this date is not possible for me, or evenings are not possible on these days, or what? I'm going to look at Councilmember Vasquez.
I mean, based on this sheet and my own knowledge of my own personal schedule, Mondays look promising. It seemed like there is some availability on Mondays, but I don't know what the schedules look like for our new members. I think it's easier to discuss what could work rather than to outline all the stuff that won't work, because that's gonna be a longer list.
How do Mondays look for our new board members?
Not good.
Not good.
Not good.
Dr. Harvey, you probably have as busy a schedule as we do. Is there a particular time that would be perfect for you or a set of times that you'd like to propose?
So Tuesday afternoons, I generally can make work. So after 1 or 2, and I can go in the evenings, Tuesdays as well. Thursdays, I can usually make happen. I do have some conflicting meetings, but if you were like, which one of the Thursdays every month or whatever works, I'm sure line that out if that's helpful. But I'm also willing to do, mornings or blackout some midday or evenings, as long as I just have it planned ahead, I can usually make it work.
Is there any board member that could not ever attend like an afternoon meeting that would like really want these to occur in the evenings?
Depends on the.
I would just, go ahead.
Go ahead. Board
I would just
Member
say the
Nelson.
later in the afternoon, the better for me.
Okay.
That 4:30 to 6 time is great. However, this second Tuesday is the only day of the month that I have a different commitment in November and December this year. I'm wrapping up some work on a national committee, but beyond that, I can pretty much make any late afternoon work.
Are we talking about Tuesdays only or?
No, I'm talking about just whether, no matter what day.
Wednesdays and Mondays, Wednesdays are really difficult for me because I have the Regional Housing Council and New York City Transit and they alternate between each other, so
Yeah.
my Wednesdays are
Wednesdays are bad.
bad for me.
Okay, I'm just throwing something out. Thursday,
Thursday.
4:30 to 6.
Scott
No,
Council.
Council, yeah, we've got Lacey Council. And that starts at 5 or 6.
6,
Yeah.
yeah.
Other than what Board Member Nelson said, is after this next couple of months, I mean, it seems like we all made it to this one.
Tuesday, 4:30 to 6.
Yeah, something like that,
Yeah,
if
pushing it
that
a
would
little
help.
later, yeah, later in the day helps me, because otherwise I have to take more time off of my day job to
Yeah.
be here, but Tuesdays could work for me.
Board Member Williams, what would 4:30 to 6 on Tuesday be for you? Doable?
That works for me.
Okay. Is that something, and does anyone care about the first, second, third, or fourth Tuesday of the month? Like we've done second Tuesdays, is there one that's out, or does anyone care? It stays on the second Tuesdays? Okay, looks like that's
We can do it, yeah.
second Tuesday at 4:30.
Mostly, we'll be done with our meetings by then.
Yeah, I mean, it would be rare that that's 2.5-hour meeting.
And we can get away from having public hearings on that day.
Yeah, and I will encourage not to be the 4th Tuesday because you have a late meeting, Board of County Commissioners late meeting on that.
I'd say to stay with the second.
So I have a consideration, and this is for the future as we go to Olympia City Council and Tumwater City Council. I'm not sure when Neil holds that, just a consideration that they do have their council meetings on Tuesdays instead of Thursdays.
Oh, so like in 2
Years down the road,
Yeah,
yeah.
in 2 years,
down
you
the
know,
road.
rush into the meeting.
But just,
But every council meets on one of the days, right? I think.
I don't know, I know that Tuesday's one of
At
the
that
days,
point, you will probably amend the resolution.
just a heads up,
Okay, so I'm gonna propose
thinking for the future.
second Tuesday, 4:30. And that would mean the next board meeting, which would have to be a special meeting, right? Because we haven't passed a resolution creating it, but our next meeting, special meeting would be November 8th. Election day at 4:30. Okay,
So is that 4:30 to 6:30 or 6?
well, it's 4:30 to whenever we're done, actually.
Okay.
We have never stuck to it's hard for this board to stick to a set time because we've had an hour and a half of public comment. Back when schools were closed, and I mean, so, and you have to allow for that, and then we've got business to do. So it's not really, with public comment being so variable, we try to time the agendas so that it's not gonna be a 3-hour meeting. I would say in general, 90 minutes, I would say, is a typical length of a Board of Health meeting. If it goes more than 90 minutes, it's because we didn't plan it that way with the agenda. It's because we had an especially robust amount of public comment. But that's why I say 4:30 to 6, because that's what you should generally be able to count on. Estimate, yeah.
And I just want to reiterate, and it's fine, but for November and December, I'm not available on the second Tuesday. Beginning in January, I will be.
Would that change if it was the third Tuesday?
Yeah, it's just the second Tuesday. I have a commitment that I really am obligated to follow through with.
Let's just look at that for a minute, because I don't personally have a preference. I would be,
I don't think it's.
well, November 15th, we're all at the county leaders conference, so we wouldn't be able to do that one. The three commissioners, and then the 3rd of December is the 20th, and I would be available. So we're gonna be missing members. We may,
May I add real quick? Our meetings are also live streamed, so I mean, if she is unable to attend, wants to catch up on the meeting as well, in addition to the meeting minutes that are provided, I can get her the link for that from our YouTube channel as well, so she can keep herself caught up if she's unable to make that one, and that's generally the meeting time frame that works for everyone else.
Great.
okay. Is anyone comfortable with that as a proposal, or does anybody else want to weigh in?
And those that maybe can't make it for one reason or another we're still gonna do the hybrid, right? Is that the plan?
Yeah, I mean, you
physically
could,
be
but if she has a conflicting meeting, she would just have to watch it.
Right, but any one of these that don't work, it might never work for everybody.
For everybody, right. Is it okay if I join late if my other meeting ends early, or is that
Absolutely.
disruptive? Okay,
You can zoom in at any point. We're very flexible, not a problem.
Great.
Okay,
Thank
well, I think that's, yeah, County Manager.
Just in terms of the location, the next two meetings, November and December, will be held in this room 280, but beginning in January 2023, that will be located in the 3000 Pacific Avenue. That's where the new board meeting will be located. Just to give an indication.
And there'll be a dais like this that's long enough so you can all sit up there if you're all in person.
So
It's a little bit bigger boardroom.
We can plan for a dais that is enough to accommodate all of you sitting on front. So this setting that you see right now is temporary, November and December.
Okay, very good. Okay, do we need anything else covered for item B? I'm looking at the clerk, I'm looking at my administrator. Okay, then let's go to item C. It's labeled subcommittee establishment, although I think we can cover a couple different pieces within this topic. Why don't, Kurt, you explain kind of what we're trying to do here?
So what we're looking at is for subcommittee, number one, to see if the Board of Health wants to have a subcommittee that helps with agenda development for each of the meetings. And so what that would be is getting together in a meeting, depending on how many people are on the subcommittee, with myself, the board, the current board of the Board of Health, clerk of the Board of Health, and to talk about what the potential agenda items could be placed out there. And then, but there's also other subcommittees down the road that the Board of Health may want to elect to put together, such as, I'm just going to have what other committees or boards have out there is like a budget committee and or other pieces and parts, committees like foundational public health, et cetera, some of the parts of public health that you may want a subcommittee on to do. So that's up to the Board of Health, how far or deep that you want to go with subcommittees.
Board Member Edwards.
I guess, but it's not necessary.
Correct.
That we have any subcommittees. I mean, we can just talk about, it might be simpler to put that together, at some point in time, but I don't think it's gonna, and it's not, at this point, it won't entail a regular routine meeting at some point. It's something in the future that may develop, and we're just leaving it open for an option just in case, I think. Is that kind of right? I mean,
That's my understanding as well. It's whatever the Board of Health wants to determine to have as subcommittees, and maybe the first one might be an agenda subcommittee that helps with developing the agenda.
Yeah, that's the real, I think, sort of pressing, is what's the process by which our Board of Health agendas will be developed? Before this, when there was just 3 commissioners, the chair and the administrator would have a Zoom meeting or an in-person meeting once a month to just kind of go over topics we've heard about, input, whatever we've heard or thought or was left over from a previous meeting, and just kind of sketch out the agenda and we would, Jamie would put it together in draft form and then we'd look at it again and just, okay, is that what we want? And that was it. That was basically the subcommittee on, but with an expanded Board of Health, there might be more folks that want to have input into that or spend time doing that. We could make it the chair and the vice chair and like I'm on the climate steering committee, for example, in that group, which is analogous to this in certain ways. The chair and vice chair and administrator do a Zoom. And we pick a day, but it moves around depending on our schedules. It can be very flexible, but we try to find a time to develop the agenda, go over topics, kind of sketch out a set of proposed agendas for the next few months. Always taking input from board members if they want to provide it. But anyway, we just need a way to do all that. Board member Vasquez.
That was my question, is just if we have a group that their function is to put together the agendas, is there a way for other board members to suggest like, hey, this is something that's getting a lot of discussion in the community, or hey, I heard this from the Department of Health, can we add this to the next agenda item? Just having a way to, even if it's just an email saying, hey, can we add this for consideration for the next agenda item?
Yeah, emails to Jamie and Kurt, would be just, that's what we want. And we want to hear that. And then, we're always, a lot of times we're looking for topics to cover, other times.
And they can also talk amongst themselves as long as it's only two or three.
We're allowed to talk to each other.
To come up with something.
Yeah, county manager.
Maybe going back to the concept of subcommittees. And I will hate to put on the spot board member Vasquez, and she can probably share your experience as a council member on the subcommittees the city council has.
Right.
That might be probably the concept the Board of Health members can gravitate. If you can share your perspective or your experience of the subcommittees as a council member.
Which ones do you have?
So I'm on land use and transportation for Lacey, and often the agendas are populated by a mix of ongoing projects, right? For transportation, for instance, we have projects like sidewalk repair or installation of roundabouts, but we get updates on projects, either funding for projects or projects in process, in flight. But there's also regular reports that need to be done on a periodic basis. I don't know if there's anything similar for the Board of Health where maybe every year we have to pull data or produce an annual report that says what we did this year. But some of those periodic things, those get put in. And then it's also public comment or questions from the community saying, what are you doing about traffic calming on 57th Avenue? And we will put it on the agenda for the next meeting to have a conversation about what traffic calming practices for the city look like. So it's sort of a mix of ongoing projects, regular reports, or regular like the cadence of work that happens every year, and then feedback from the community.
And who sits on, like, give me an example, who sits on your transportation committee? I don't mean personally, but is it 2 council members, 3 council members, a staff?
It would be 3 council members and then usually the city manager and other expert staff, like Scott Eggers, our head of public works, would sit on the transportation committee because he would supervise all the people that do the transportation related work.
But you'd have, so like if, for example, if we had an environmental health subcommittee, 3 Board of Health members and Art,
Right.
who's our division director for environmental health, I'm just thinking how that might look.
Thank you. Also, if you could elaborate what type of recommendations the subcommittee provides to the whole city council.
Yeah, so usually when we, have a discussion or we get an update in one of the committees, usually what happens is that if there's some action or there even needs to be an approval of a report, the preliminary review happens at the committee level and then it comes to the full city council for final approval, final action, or final review. So it's the committees feed up into the main group for final decision, funding, et cetera. So if our committees function similarly, then if we had an environmental health committee, it might make recommendations for action or review reports and then bring it to the full Board of Health for final decision or review.
So we had, just as an example, we had community members come forward and show us that these pop-ups around breweries and distilleries and stuff, pop-up food, they didn't fit into our permit system very well. And so a subcommittee, if we had one related to food inspections and stuff like that, could have developed, look at the permits that we had and the fees and look at what was happening in the community and figure out and we did that ourselves, but I mean, that would be the kind of policy recommendation that they could chew on and bring to the Board of Health. Is that kind of what you're thinking, Ramiro?
Yeah, and I appreciate that, Board Member Vasquez, because that's the concept, I believe, at least from my point of view, as to how the Board of Health members could consider subcommittees. Because there is a lot of opportunities, there is housing on public health and social services, there is infectious diseases element, there is a nurse-family partnership elements, there is environmental health, septics, food inspections. There is a lot of opportunities that perhaps the current Board of Health members can get a little more involved into the process by being part of the subcommittee. I just give you more work.
Okay, well, I think, so I think Board Member Edwards is correct that we mainly wanted to introduce this concept because it's new to us as county commissioners as well. And we wanted you to sort of think about, the capacity you'd have to serve on such a subcommittee, the topics you think are meaty enough or interesting enough to warrant having those subcommittees. We've never had them, the Board of Health, but it could be something we do. I would like to walk out of here though today with sort of a little bit of a discussion about agenda setting and what people are comfortable with in terms of what comes before you as agenda. Remembering that we will always take, whoever is involved would always take input from all board members. So even if you're not on the agenda setting committee, if you think of an idea or you hear something from the community you think needs addressed by the Board of Health, make sure we know about that. Board Member Vasquez.
I mean, this is kind of a giant one, and it's probably the essential role of the Board of Health for the next year or so. But identifying some of our strategic priorities and how we allocate funds or how we recommend the allocation of funds for the Board of Commissioners to approve. That's like huge, right? But
Setting strategic goals.
we have a very quick turnaround, as I understand it, for allocation of some of the funds or requesting funds from the legislature for the coming year.
Like foundational public health.
I was gonna say, foundational public health is part of that. One of the pieces is that because we have such a short turnaround, it started July 1st because it's a state fiscal
Can you
year.
explain to everyone what this means, foundational public health,
Sure.
and why this is like a thing?
In
So-
30 seconds or less.
Yeah,
I know it's a big deal, but the discussion will be meaningless if people don't understand.
So I think part of one of the agenda items that we're looking to for the future is a discussion on what's called foundational public health. Starting in 2015, the state started doing a study and pulling together what should be the principles of public health that are funded by appropriation that only local health jurisdictions do. So in other words, the example I typically use is vaccination. Local public health jurisdictions do educate the community to get vaccines, to get vaccinated. So if we're educating the community, that's eligible for foundational public health funding. If it's actually inoculating or putting a needle in an arm, so to speak, for vaccination, that's not eligible for foundational public health because that's done by a whole host of healthcare providers. So foundational public health is typically what's not done by anyone other than local health jurisdictions. There is, I'm going to say right now, roughly $2.6 million as of July 1st from the state. However, $1.4 million of that was already obligated, thank you, that's the word, obligated by the Board of County Commissioners last year. And so that obligation continues. However, there's a $1.2 million that came in starting July 1st, new funding that's going in front of the Board of County Commissioners this month because it's a requirement of our budget development process that we have to go through by state statute this month and into December to obligate these funds. What we've done though is we put a portion of this funding aside for the Board of Health to make recommendations to the Board of County Commissioners so that we can implement that with the Board of County Commissioners approving that implementations after January 1st during the next round of quarterly budget process. So all that needs to be explained, and the foundational public health piece of it, it requires more than just 30 seconds. It requires a whole agenda set item that we can sit down, show you what's already been obligated and appropriated, and then turn around and say, where does the Board of Health want to go, and with recommendations from staff that may or may not meet the Board of Health's criteria for policy development.
And that this money is intended to be, legislature can always change its mind, but it's intended to be ongoing. So even if we're doing stuff kind of quickly this year because of timelines, in the future, the Board of Health could weigh in on priorities.
Absolutely.
As an example, in that first round of funding we got, one I remember, because I was really focused on it, was a chunk of it had to go to environmental health, but it was up to us to pick which environmental health priority. Well, the board had been struggling with how to do a better job with our septic pollution identification and control and management. So we took 100% of that chunk of the money and put it toward hiring, really beefing up our staffing on septic pollution identification and control. So that was something that we were able to do locally. Another county might have done something totally different with that chunk of foundational public health money. So there are definitely side rails, but then there are policies within the side rails that allow us to make some choices. Assistant County Manager.
So not immediately, but not too far in the future, it may be helpful for the Board of Health to have an overview of how the county budget process works. Because our community members probably don't know it all, and it is a little different than the cities.
And different than the state.
Oh, very different than the state, yeah.
Yeah.
Okay, Board Member Edwards, and then.
I would just say that possibly we've canceled, not a fair amount, but it's not uncommon that we would cancel a meeting, a Board of Health meeting with the three of us. Maybe a lack of agenda, no pressing issue at the time, or whatever it is. So I guess I'd say that it's rather important, if you've got an issue that you think is important, that you basically speak up and say, well, what about this or that? Can we put this on the agenda? Less likely that we're gonna cancel something, but it would be the whole group making the decision if we've got agenda items to address.
Absolutely.
I've already sent a couple recommendations to Chair Menser.
Okay. Like just now?
No.
Board Member Vasquez?
And then Ramiro had his hand up
Yeah.
as well, but just, can we get some of the information about available funds and what the potential is to use those that are not already allocated in advance of the next meeting, so that we can
Yes.
have a really robust conversation at our next meeting?
So part of our budget cycle says that it will go in front of the Board of County Commissioners for deliberation, October 24th, do I have that date right, Robin? Okay. But they will not actually take action on the actual budget until December.
So just very quickly how it's going to work is our board has to make budget decisions for the preliminary commissioner's budget no later than October 28th. We're hoping to wrap up by October 26th. That is so staff have enough time to publish the board's preliminary budget by, I think it's like November 20th it's earlier than that. But mid-November, we have to publish the budget so that it's available for public comment, and the board holds their public meetings on December 5th and 6th. And then they will adopt the budget by December 16th. So not a whole lot of time to weigh in this year, but one of the items that is in the requested budget that the board is considering is a placeholder of a chunk of this foundational public health money so that the Board of Public Health can weigh in on how it gets spent next year. So there is a placeholder there. The board has to appropriate it by the end of this year. on the timeline that I just stated, but hopefully we leave a little bit of wiggle room for you all to do some important things in the next few months.
So, and I was gonna say that I can get you that information, but it's gonna be subject to change. In other words, it'll be what's cleared October 24th, but it will not be what's actually approved until the December 16th action that's taken.
That makes sense.
And I think it's important to note that by statute, these dates are in the mix. So it isn't like we've just arbitrarily picked something. We've got to make these deadlines due to RCWs. So I can't imagine that our new folks are going to have an understanding of how complicated this gets to be. And I see the county manager.
I think I was going to walk through exactly what Robin stated. This year may be a little bit off the time just because the logistical elements of conducting meetings and providing adequate information for you to provide a good decision-making process. But certainly next year, I think will be a very robust year. Considering that maybe a set aside, if there is any recommendations the new Board of Health will provide to the Board of County Commissioners, there's an opportunity for the first quarter budget amendment that will incorporate the specific activities. But certainly, I believe that will be a great opportunity for the Board of Health to consider a finance subcommittee. They really start getting into the nuances and the details of that to provide recommendations to the Board of Health and to the Board of County Commissioners. If I may, before you leave this topic, Mr. Chair, is to, in addition to define what would be how the agenda setting would be, to see if there's an agreement on the concept of subcommittees, so we can incorporate that on the resolution that might be up for your consideration next meeting.
So the resolution, the process resolution, we'll try to put in sort of a mechanism by which we can create subcommittees, provided that seems like an acceptable thing to the board. Do I have kind of concurrence on that?
Yes.
Am I seeing any? Okay, and then, so that's approved, or that's agreed, concurrence. And then if I were to propose that the agenda setting subcommittee be the chair, vice chair, and administrator, I don't know that we need three. You know, I'm trying to keep things simple, because everybody's got time commitments and scheduling commitments. I'm just gonna throw that out as a possibility. Does anybody feel that that's not a good way? They'd like to add another person? They'd like it not to be the chair or vice chair?
That's fine with me.
Chair, vice chair, and administrator as an agenda setting subcommittee.
I'm intensely supportive of fewer meetings when possible, so.
Yes.
But I also, to the county manager's point, I think having a finance committee stood up soon is a good idea. So we have a group of us working on budget suggestions.
Okay, that could be the first one we take up next meeting.
And a lot of this is going to reflect may rather than shall, I think, right?
Yeah, I think you're right.
Give you enough latitude.
Yeah, we'll have latitude. Now,
The doctor's got her hand.
yeah, Dr. Hart.
Hey, I just was wondering if you guys had any information that you thought we should be reading.
Dr. Harvey, I'm sorry. We have this weird thing where when you start talking, there's a sound lag. So could you just start over? We got you now.
Okay, so is there anything that we should be reading about or learning about? Like, do you have a strategic plan, or are there certain things that you think are kind of like things we should be learning about so that we're prepared kind of as we're moving forward in this next year? Or are we still kind of just starting from the ground? Because I don't want to push on anything that you're like, oh, we already have that, or, you know. I'm just trying to be open-minded and learn, but I also would love to know kind of what's already in place so that maybe we could inform it. Because as I think about like subcommittees, I'm like, well, it kind of depends on what the work is, maybe what the subcommittee would be, if that makes sense.
There was a lot of body language in the room that suggests we don't have a lot of that foundational stuff yet.
We do have a strategic plan. The county has a strategic plan. It's slightly outdated. And the department also has a strategic plan, and we'd be more than happy to share what we've got.
And just keep in mind, everything is pre-COVID, when you look at
Right.
the information that's out there. And so,
And I think this comes back though to who can they contact, which you threw yourself on the.
well, I mean, I can farm it out to the appropriate staff person
Sure.
and get the information, but at the
But-
same time, I didn't wanna throw one of the other staff members out there who would be, like the PIO, who would like to, you know, I don't want her to get overwhelmed either.
So we can also provide budget information currently for the Public Health Department in the context of the county budget.
Cause you have the
We
budget book
can-
online.
oh,
and
yeah. With all the current budget requests, we can make available anything like that.
And also, sorry,
Yeah, go ahead.
we'll be working on logistical elements to provide you a county issue email. And maybe if you're in need of a county issue laptop or a Surface, let us know. And we also will be providing you a county issue cell phone. Because any type of correspondence that you will have during these meetings, I will encourage for you to use the county issue equipment, because those will be up for public records request. So it is important for you to have that in mind. So I encourage not to use your personal devices. And again, we'll provide you all the devices you need to conduct your business as the new Board of Health members. But again, anything that you do within the county business is as a public record.
Okay, typically, so any other questions about this subcommittee general topic? Typically, this is a special meeting, and typically our regular meetings will usually conclude with a report from our public health director and our health officer, just a brief report on what they've been working on and what they want the community to know. We don't have that in today's agenda because it's a special meeting and we were just kind of getting logistical elements, but you can expect that at future meetings, I think. Those are relevant to have as standing items at the tail end of the meeting. So it's 5 o'clock. Does anybody have anything for the good of the order? New members, any questions, lingering questions? Sounds like we're gonna be back on November 8th at 4:30. And the agenda for that meeting will be prepared by myself at this point, Kurt, and we'll get input from our vice chair as well.
Sounds good. And it's the second Tuesday of every month, it's once a month.
Second Tuesday of every month, unless we can always set a special meeting.
Okay.
But that'll be our regular meetings, and there'll be a resolution probably provided in advance of that meeting for everybody to look at and comment on, because you'll hopefully adopt that resolution as a business item at the next meeting.
I have to say, I'm hoping as this thing develops, that we get more timely on material for members.
Yep.
Okay?
Yep.
I don't know what that means at this point, but it's kind of been a bugaboo of mine, so I think, you know, more to come on everything, you know, the whole thing. This is a good little get-together.
Yes, Board Member Williams.
For next month, we're meeting in person.
If you can,
Yeah.
we're gonna have in-person meetings all the way
All the
through.
time.
If you have to access the hybrid, because of a scheduling issue, that's fine.
Okay.
But-
And then one other question that came up, for a subcommittee, how many people do we need?
3 or less.
Yeah, 3 or less,
Yeah.
because we don't wanna be a quorum.
So,
It can
okay,
be 2 or 3 with a staff member, depending on what the topic is. If it's a really discrete topic, if it's a bigger topic, like the budget recommendations, that's probably gonna need to be 3 people. I'm just guessing.
okay, thank you.
Okay, hearing nothing more, we're adjourned.